Hai mampap, kita masuk lagi ke sesi pertanyaan. Sekarang yang kedua ya. Ini ada beberapa pertanyaan yang kita mau tanyain ke Erin. Okay, for the first question, Erin, this is the most common thing happens here. Mothers always ask about it. So, is there any nipple confusion? Bingung puting ya moms, pap ya. Kita tanya Erin ya. Nipple confusions. Okay.
So the answer to that is no.
Oh, no. Okay.
What I always tell the families that I work with is that the baby is not confused. The baby has learned either breastfeeding or bottle feeding, and so they don't know how to go back and forth. So it's not that they're confused, we have to teach them, and you learn by practicing. So we would say it's easier to learn one thing than two things at the same time. So practice breastfeeding right from the beginning, and after breastfeeding is going well, after 2 weeks or maybe 4 weeks, then the baby can start learning about bottle feeding. And you still have the reflex, the automatic sucking, that will help your baby practice bottle feeding, and they already know how to breastfeed.
So it's okay to start bottle feeding at 2 weeks, right?
Yes, that's what we recommend.
Okay. Jadi mam, menurut Erin gak ada yang namanya confusing nipple atau bingung puting. Yang ada adalah bayi itu harus belajar. Jadi mereka akan lebih mudah belajar satu hal ketimbang dua hal. Makanya kalau memang dari awal sudah breastfeeding, kemudian kita ganti bottle feeding and then backward forward breastfeeding, bottle feeding, bukannya mereka bingung, tapi they learning, mereka itu sedang belajar. Jadi terus aja paparin, nggak jadi masalah. Bahkan menurut Erin, kita bisa mulai kasih bottle feeding walaupun kita breastfeeding full ya di usia 2 minggu, tapi tidak langsung berapa kali sehari, enggak. Jadi kita selipin aja, misalkan hari itu kita selipin 1 kali bottle feeding, kemudian besok 1 kali lagi, di gradual aja, bertahap. Tujuannya yaitu biar bayi belajar, bukan bayi bingung puting. Okay? Next questions, is it pacifier okay? Nah, boleh nggak sih ngempeng? Kita tanya Erin ya.
Yes, the pacifier is okay. So what you want to think about is if you have a healthy baby, you are the pacifier.
Oh, okay.
As a mom, every time your baby cries or wants to suck on something, when you have first had a baby, you want to let them go to breast. Because even if they're not getting any milk, they're stimulating to get the milk to come in. And so it's really important that healthy babies, that you think of yourself as a pacifier. And if you have a baby who is in the hospital for a long time, the baby still needs to have some way to calm down. And if you can't be there, or they're too sick to go to breast, then a pacifier will help them to calm down.
Okay.
So pacifiers are fine, and we are finding now that pacifiers in the little bit older baby can help decrease the risk for sudden infant death syndrome.
In older baby. So it's okay, but is it okay like for long term or just like for maybe a few months?
So the way that I explain it to the families that I work with is that your baby when they're born really only has one way to calm down, and that's sucking. And so you want to let them learn how to calm down by letting them have the pacifier. But when your baby starts to get older, then they can learn to calm down in different ways. So if your baby is fussing and you're over there, you can say, it's okay. And you can start to use your voice to see if you can help them to calm down. If they are able to move, like roll or crawl, then I start to actively stop using the pacifier. So the baby fusses, and instead of giving them the pacifier, I say, "Oh, you're okay," and I pick up a toy. And I show them the toy, and I start playing with the toy. The baby will learn that, hey, if I'm not happy, maybe I'm bored, maybe I just need to move over here, maybe I can pick up this toy. And now they have lots of ways to calm themselves down. And once they can do that without just the pacifier, then you can usually get rid of the pacifier without a fight. So we try to stop the pacifier by about 9 to 10 months.
9 to 10 months. Oke, Kak. Oke. Jadi boleh pakai pacifier, bahkan ibunya sendiri adalah pacifiernya. Jadi empengnya ya ibunya sendiri. Nggak perlu pakai empeng-empengan kalau ibunya bisa memberikan empeng secara alamiah. Jadi tujuannya pemberian empeng itu adalah pada saat bayi dirawat di rumah sakit, mungkin dalam keadaan sakit dan ibunya tidak ada di situ dan butuh kayak calming down, itu bisa diberikan hanya untuk memberikan rasa nyaman. Nah, kalau nanti begitu sampai rumah ada ibunya mau breastfeed untuk menggantikan pacifier pun langsung direct ke ibunya, itu juga boleh. Nah, tadi pertanyaan berikutnya, sampai kapan sih kita bisa ngasih pacifier? Menurut Erin, sampai kita bisa mensubstitusikan, jadi ada penggantinya. Contoh, kalau anak sudah bisa bermain atau dengan suara ibunya saja dia sudah bisa tenang, kita nggak perlu ngasih pacifier. Jadi sejalan dengan anaknya itu tumbuh dewasa, dia akan bisa mencari cara untuk membuat dirinya tenang. Apakah itu dengan bermain ataukah suara ibu. Nah, kalau memang dia tidak tahu caranya, kita tunjukkan atau kita gantikan dengan memberikan mainan dan lain-lain sehingga dia bisa mulai tenang. Mungkin di sekitar usia 9 bulan kita bisa menggantikan si pacifier itu dengan hal lain yang membuat bayi tenang. Okay.
So can I say one more thing?
Okay, sure.
Because if you go home and you are, every time your baby fusses, you're putting them to breast so that your milk comes in.
Yeah.
When do you start the pacifier?
Okay.
That's another question that I get. And so what I say is, if your milk is all the way in, then you can start the pacifier. And so I would, if your baby starts to fuss and you think it's time to eat, I would put them to breast. If they just finished eating and maybe they just seem like they're bored or unhappy, then I would start using the pacifier.
Okay,
so it can be within a week or two.
Oh, okay.
After birth.
So baby just looking for comfort. Comfort.
Yeah, we all need to have a way to calm down. And you and I can do things like take walks, take a bubble bath. Babies just have one way, and that's to suck.
Jadi pertanyaan yang sering Erin dapetin juga, kalau dari awal tidak diberikan pacifier, kapan sih kita bisa ngasih? Kalau misalkan kita sudah nenenin nih, kemudian anaknya kenyang, tapi dia kayak masih fuss, masih resah, kayak cuma pengen sesuatu untuk sucking tapi nggak mau ada milknya. Nah, itu kita bisa kasih. Kita bisa kasih dengan range 1-2 minggu aja, jangan terlalu lama ya, Mam. Karena nanti untuk substitusinya akan lebih susah lagi. Okay, next question. Is bottle feeding correlate with speech delay? Nah, ini sering ya, semua moms pasti bingung, kenapa sih speech delay, apa gara-garanya bottle feeding? Kita tanya Erin ya. So Erin, is bottle feeding correlate with speech delay?
I'm not sure what she means by this, so let me answer it in several ways.
Okay, great.
If the question is, if the baby drinks from a bottle instead of breastfeeding, is that going to affect their speech development? And the answer to that is no. Okay. If what she's asking is, if the baby is having problems with bottle feeding, does that mean they might have problems with speech? And the answer to that is yes. Because if a baby is having difficulty with feeding, it might mean that they have an oral motor problem. There's lots of reasons why babies may not eat well, but if they have an oral motor problem, that oral motor problem can affect eating and speech.
Oke. Jadi sebenarnya ada banyak jawaban untuk pertanyaan ini karena kurang spesifik. Kalau pertanyaannya adalah apakah botol berhubungan sama speech delay, jawabannya tidak. Tapi kalau pertanyaannya adalah apakah gangguan makan berhubungan sama speech delay, bisa aja iya, karena gangguan makan itu bisa juga karena gangguan oromotor, sedangkan oromotor itu berhubungan dengan makan dan bicara. Oke, kita lanjut ya. Pertanyaan berikutnya, is there any effect for babies that usually direct breastfeed, but during the mother work out of home, they using a bottle? So let me simplify this. it's quite complicated question. Okay, is there any effect for the babies that usually direct breastfeed, but during the mom work, the baby use bottle feeding? So is there any effect of that?
No. There's no effect for that.
It's fine.
Yeah.
As long as the baby is learning, right?
Yes.
So there's no confused nipples.
Correct.
Yes.
Yes.
Simple answer, complicated question. nggak ada hubungannya, nggak ada masalah. Jadi kalau moms mau kerja aja. Anaknya pakai bottle feeding di rumah, nggak apa-apa. Justru dia biar belajar. Makanya tadi pentingnya pengenalan di awal, ya.
Actually, let me make it more complicated.
Okay, great.
The only thing though that you want to think about is if you have to work and you're leaving your baby, you still need to empty your breasts.
Okay.
Because you will see, if you don't pump during the day, that the milk supply will come down. And so it's not that the bottle is causing a problem, but if you're not able to direct breastfeed during the day, you need to think about how do I maintain my milk supply.
So maybe moms can pump while they work.
Yes.
So it will stimulate more milk.
Yes.
Okay.
Yes,
Jadi,
that's actually really important to do.
Yeah. Yang mau Erin tambahin adalah kosongin breastnya dulu sebelum kerja. Jadi dia bisa terus memproduksi ASI lagi. Kalau memungkinkan justru pompa pada saat kerja. Jadinya ASInya tidak menurun dan produksinya tetap sama. Okay. Next question, Erin. Which is best? Nah, penting nih, mana yang bagus? Cup feeder, spoon, or bottle? Sering nanya kan? Yuk kita dengar.
What's best is breastfeeding.
Okay, breastfeeding. Okay.
If you need a different way of giving your baby your milk while you're learning about breastfeeding, I have said this many times in the last 2 days. I have seen some of the best feedings with cup feeding. When you are cup feeding your baby, you have to be really watching them and responding when they say, oh, that was a little too much. And that's what we want during feedings. That's ideal. And sometimes with bottle feedings, parents don't really watch what the baby is doing anymore. They're thinking about the bottle. So I would actually say the cup. And if we think about it, syringe feeding, spoon feeding, cup feeding, bottle feeding, ideally what we're trying to do is just help the baby until they can breastfeed. And so if you've been using a cup or a spoon and you've been working and trying to get your baby to breastfeed and it's not working, as they're getting older, then I would ask yourself, do you think they're going to go to breast? If not, then it makes sense to start bottle feeding. So transitioning from cup to bottle feeding would really be only because you've decided that your baby isn't able to breastfeed.
Jadi yang utamanya sih sebenarnya breastfeed. Menurut Erin, di antara cup feeder, spoon and bottle, cup feeder itu kayak lebih menyentuh untuk Erin karena itu dibutuhkan skill dari ibunya, dimana dia ada interaksi dua arah dari baby sama momsnya, dan moms itu harus benar-benar tahu cue-nya kapan dia harus nuangin ke mulutnya, kapan harus dia stop. Nah itu penting banget dan itu dibutuhkan skill yang lebih advance ketimbang bottle feeding. Bukan berarti cup feeding itu lebih baik, cuma interaksi dan skillnya yang dibutuhkan itu lebih banyak dibandingkan spoon feeding atau bottle feeding. Tapi ingat semua ini hanya untuk sementara sampai anaknya benar-benar bisa breastfeeding. Kecuali ibunya memutuskan untuk tidak mau melakukan breastfeeding, maka semua ini sementara sampai dia nantinya bottle feeding gitu ya. Jadi nggak cup feeder sampai selesai, tapi harus ada transisi ke bottle feeding kalau memang tidak mau breastfeeding. Okay? Last questions. Let's see. Oh, I think this is your things cue. What cues that baby ready? What cue that we should know? It's a sign that baby is ready to have solid food.
Oh,
Yeah.
that's a great question.
Yep.
So there are a couple of things that we think about for development because it is sort of tied to their age, but it's more that the baby is showing interest. So if you're picking up your spoon and feeding yourself, or you're feeding yourself solid foods, a baby who's ready to start trying will usually be watching you. Because they're interested. They're like, what are you doing? So there is an ability to learn basically from looking. The other thing that we look at is, can the baby hold their head and have some solid sitting? Even if you put your baby sitting and they can sit for just a couple seconds and then they go, oh. If they can have enough trunk and neck control, that is also necessary for learning about spoon feeding.
So stability is important.
Okay. Stability. Yeah.
Okay. Jadi kita tahu cue-nya kapan bayi itu bisa mulai dikasih makanan adalah kalau mereka sudah terlihat interested sama minat kita makan. Biasanya kan kalau kita makan mungkin sekitar about 6 months, 5 to 6 months.
Yes.
Yeah.
Yeah. Usually I would say somewhere between 4 and 6.
Oh, okay.
And most families, even in different countries, most families introduce solids around 5 months.
Okay. Jadi sekitar usia, kalau menurut Erin 4 sampai 6 juga udah mulai. Jadi pada saat kita makan, anak-anak kan suka pada gitu kan. Nah itu udah tandanya dia tuh kayak apa sih itu gitu, kayak udah pengen coba-coba. Nah itu salah satu interaksi sosial yang cue-nya itu seperti itu. Kemudian yang kedua yang harus diingat adalah trunk sama neck kontrol batang tubuh dan leher, karena kalau untuk makan dia butuh stabilitas dari tubuh sehingga dia tahu apa yang akan mau dimakannya, kemudian dia bisa duduk tegak, mau itu di high chair atau tidak gitu. Jadi stability dari batang tubuh itu penting. Jadi 2 cue itu paling tidak kita pakai untuk persiapan anak makan. Okay.
And it's really important that if your baby was born early, that you use their adjusted age.
Oh, oke. Kalau anak-anak prematur, bayi-bayi prematur, kita gunakan usia adjustable age, bukan correction age, right? Bukan correction age. Jadi apa itu correction age dan adjustable age? Nanti ditunggu ya dari dokter-dokter RC lagi buat jelasin itu. Oke, maybe that is for now.
Yes.
Oke. Sampai segini dulu ya, Moms Pap. Nanti lagi kita adain lagi sesi berikutnya. Bye.
Bye.